This is the Northeastern Service of All India Radio broadcasting from Shillong. We now welcome all our listeners once again to our live Radio Bridge program. And today the topic is community participation and efforts in combating COVID-19 in the Northeastern region. Our participating panelists include Dr. Jago Ori, who is an MS ENT, Assistant Professor, Department of ENT, Tomo Riba Institute of Health and Medical Sciences, and member of COVID-19 State Task Force, Government of Arunachal Pradesh. We are also being joined by Dr. Lal Rem Ruati, who is the Assistant Professor, Department of Psychology, Government Aizawl West College. We also have with us Shri Tenzing Norbo Lamtha, who is the founder president, Sikkim Himalayan Sporting Club Gangtok, and not the last but the least, Dr. Arambam Noni Singh, who is the Assistant Professor, DM College of Arts, Imphal. So we have all these four states, that is Arunachal Pradesh, Aizawl, Sikkim, as well as Imphal, who's joining us in this live Radio Bridge program. Let me just give a brief about why we have taken up this topic today. Well, community participation is the key to public health and has been central in previous fights and fights against previous epidemics as well. In the present context of COVID-19 pandemic, the importance of active engagement with the community and by the community has been highlighted by many. Now, global health guidelines has already emphasized the immense importance of community participation and the fact that past experiences should be our guide when it comes to managing with epidemics. Now, past experiences have shown that grassroots movements were central in responding to, for instance, in the HIV/AIDS epidemic by improving uptake of HIV testing and counseling, negotiating access to treatment, helping lower drug prices and reducing stigma. This is very important. Now, community engagement was also critical in the response of Ebola virus disease in West Africa, especially in tracking and addressing rumors. Therefore, it is once again being emphasized that for a successful, sustainable response during this COVID-19 pandemic, community involvement should and could play a key role in planning local level actions in collaboration with local bodies to identify vulnerable households, provide support to the elderly and those in quarantine, develop better communication strategies, and help in contact tracing. Though we have been witnessing quite a lot of community effort across the country, including in our very own northeastern region. But the question is it enough, or do we need a more effective and sustained community engagement? Today, we will also listen to the community efforts that are in place in the Northeast from our participating panelists in their respective states as well. So there you have it, the reason why this important topic has been taken up today. So wishing all of our panelists from Arunachal Pradesh, in Aizawl, in Gangtok, as well as in Imphal, a very, very good evening. So let us right away go to Itanagar because we have Dr. Jago Ori with us. As I said, he's an MS ENT, Assistant Professor, Department of ENT, Tomo Riba Institute of Health and Medical Sciences, and member of COVID-19 State Task Force, Government of Arunachal Pradesh. Hello, sir. A very, very good evening to you.
Hello.
A very good evening to you and a warm welcome.
Very good evening.
Yes, a very warm welcome to you. Thank you so much for coming and for being a part of this important panel discussion today.
Thank you very much.
All right. So as I said right in the beginning in my introduction, that it is increasingly being emphasized as also being realized the critical role that communities can play during these COVID times. Your thoughts on it?
Yes. In fact, you have stated rightly. The community participation, especially this COVID pandemic, plays a very critical role, especially the highly populated area like India. Since this COVID is spreading through community only, it is the role of community is very, very important in curtailing the pandemic.
And go ahead.
So that is very important. So it is one of the most strategic and very vital part of our COVID fight. We must engage our community from community at root level.
Absolutely, sir. Because Arunachal Pradesh is widely spread out, right? We have small and big communities all across. Tell me what kind of efforts has the community of Arunachal Pradesh, the people there are making an effort to play along with government agencies towards this fight against COVID-19.
Yes. Here in Arunachal Pradesh, as you know, it is area-wise, it's very wide, but
Right.
population is a bit less, around 17 per square kilometer population density. But then the COVID is now spreading in almost every district. So here, especially the community-based organizations are very strong here. You know that Arunachal is a tribal state, and it has got many different tribes and different sub-tribes. So major community, they have their own effects organization. Like, for example, Galo tribe, they have Galo Welfare Society. For Nisi tribe, they have Nisi Elite Society. So likewise, every major tribe has got its own apex body. And then there are many other religious organizations also, like Christian Forum, and then traditional Doni Polo group, and then many other Buddhist group, and not only that, even the student organizations. There are a lot of student organizations in their community level. And in district also, they have district student union in every district. And then from the COVID organizations, I mean the technical organizations also, there are a lot of, these doctors associations like Indian Medical Association, Arunachal State Branch. I am the secretary of State Branch of Indian Medical Association. So these organizations, they have played an important role, a crucial role from the day one itself.
So we will be hearing from you a little bit more after some time, sir. Let me just bring in our other panelists as well. So if I can just go to Aizawl now, because we have Dr. Lal Rem Ruati, who's the Assistant Professor, Department of Psychology, Government of Aizawl West College, also there with us. A very, very good evening to you.
Thank you so much for having me.
Yes, it's a pleasure to have a very warm welcome and a good evening to you as well. So you have just heard the opening comments made by Dr. Jego Ori regarding the initiatives that are being taken up in Arunachal. Likewise, I'm sure that in Aizawl too, the people, because I think now it has almost become a people's movement. It ought to become a people's movement. So
it does.
Yeah. So tell us a little bit about the efforts that the community are putting towards this fight, because this is a fight, a long battle I'm sure we have ahead of us. So what kind of role have the people been playing so far, the community have been playing there in Aizawl?
First of all, I'd just like to point out that Mizoram was considered as the best performing state in the fight against COVID-19.
Right.
And this is the only state in India who has a zero COVID deaths so far.
Wonderful.
And there is no community spreads as well.
Okay.
So I'd like to point out that the Mizoram government, under the chairmanship of the Health Minister, Puarla Thangliana, they had constituted a task force where we have the state-level task force, and then under the state-level task force, we have the local-level task force for every locality, as well as the village-level task force in the peripheries.
Okay.
So what happened with the task force is that the task force at the local level, the members constituted includes the village council members, as well as the YMA, which is the biggest organization in Mizoram, which is the Young Mizo Association, as well as the Elders Association, which is the MOP, and then the Women Association, which is the MHEP, as well as the church elders from different denominations. The LTF at the village level as well as of the local level, they have done tremendous work, wonderful work I would say, in combating the COVID-19, where they help in maintaining peace and order in their locality, and policing the area, including the border area.
Right.
And then they have been very, very active in distributing essentials and commodities, ensuring that no one in their local area goes hungry.
Okay.
So this includes even the migrant workers who were left behind in Mizoram, even when were illegal migrants.
Okay.
They were taken care of by the LTF.
Yes.
There's so many things that I want to say about the LTF, but then my voice is echoing, so it becomes quite difficult for me to continue.
But we are hearing you very well, ma'am. We are hearing you very clearly. There is no echo voice at all. I would just like to ask you, because we have seen all over the country that in the beginning, between say March and early April, we did see in national television also, there was some kind of stigma. The frontliners were being attacked, they're being targeted. I'm sure that, because this pandemic is so sudden and so new for us that for each one of us, I think we were not really prepared, really, in the sense that, we have to be in lockdown situation for so long, under house arrest for so long. Our lifestyle has completely changed now, than what it was before, right? So
true.
So did you also face some kind of challenges? What efforts were specially put in to make the people understand that this is a long-drawn battle? Because even our Prime Minister has said that this is a long-drawn battle for us ahead.
Yeah, I would not say that there were no issues and challenges when it comes to stigma and discrimination, but it's very, very less as compared to other parts of India as well as to other parts of the world. The thing is, when the LTF, the local level task force, as well as the village level task force were put into practice, in combating this fight, they were very effective in addressing awareness issues, as well as, which includes the stigma and the discrimination. So I think in those terms, we don't have so much issues, I would say.
And even if you had, you could resolve them gradually.
Right.
Okay.
We had no case as... I would just like to point out again that I'm also a member of Covid-19 Committee on Psychological and Social Guidance, which was formed by the Health Minister again under the government of Mizoram. So under this committee, we have a counseling cell where we go to all the government-funded quarantine centers.
Okay.
We have not found any, the issues on stigma and discrimination so far. Of course, it was not some small problem which we were able to resolve without the interference from the government, I would say.
Right.
Yeah.
Because as I said, we all have, we really had to settle down with it, and it took us some time. Because even in our state of Meghalaya, the community is playing a big role. Till today, the kind of services, so many different organizations voluntarily coming, distributing food, food and, making sure that the poor and the needy people who are not working anymore, who have lost their jobs, they are getting a meal a day. Tremendous work is going on in that front. People are distributing so much. And it is so wonderful to see that the people have come together.
Right. Okay. So we have all these funds we receive from the people. I would just point out, the little boy from Kolasip district who is a 7-year-old. He donated his entire savings of rupees 333 to the state fund to fight COVID-19 pandemic. So
we have similar stories there also. Yes,
by the people in the altruistic behavior. And
I believe that in Mizoram, because I was just talking to somebody I know from here in Shillong who belongs from your state, and he said how voluntarily people have come up. There are a lot of volunteers.
Yeah, I just want to point out again that when it comes to the LTF, both the local level as well as the village level, it was all a voluntary, behavior. There is no, they don't get any fees, they don't get any insurance cover, nothing of that sort. It was totally free of cost.
Absolutely. So wonderful and heartening to hear these stories. One thing I think COVID-19 will do is bring all people together. At the end of it,
let's hope.
Let's hope that we will all eradicate it together. So go ahead, as you were saying, that, how wonderfully the volunteers have freely come, but then how are you making sure that this is a sustained effort? What are you getting some kind of sponsors? People are sponsoring. How is it being a sustained effort?
It is, people are actually sponsoring. The thing is, we have been hearing many wonderful stories about altruism, and again, Mizo, if you know about our culture.
Ma'am, just hold on your thought. Just
Okay.
hold your thought to that, because we do have our panelist, Shri Tenzing Norbo Lamtha, with us. A very warm welcome to you.
Once again, very good evening.
Yes, you are the founder, president of Sikkim Himalayan Sporting Club Gangtok. Gangtok, Sikkim also. In the beginning, we almost thought that Sikkim will not have any case. For a long time, you pulled it on. But then, of course, now even your state has cases. Tell us the role of community that is being played. What kind of role are they playing to us fight against COVID-19?
Hello.
Yes. Your voice was a little dim, so now we can hear you. If you can speak a little louder.
Clear?
Yes, now it is fine. Go ahead.
Sikkim was COVID-free
Yes.
for up to the May 23rd. On May 23rd, we got the first case. It is not from the local, but it was from the returnees from other states.
Okay.
Still also, we are maintaining the same. In North District, we don't have any cases till now. And in East, South and West, we have something. Community level, along with the state government, everyone is working very hard. There is a formation of ward level committees there, the block level committees. And then along with the government sanitizing programs or any program moving ahead, the government is testing as many as they can in the possible manner. In the institutional unit, it's testing, and if found positive, the primary and the secondary contact, and the containment of the area.
Okay.
And sanitizing of the area.
Sir, would you agree with me when I tell you that, one of the challenge can be creating awareness at the rural level, sir? So how have you been able to, make the people understand, the community in the rural areas, about this COVID-19 situation, and that they need to play, the community in the rural areas also need to play a very crucial role?
Yes. Where I see the most crucial point that has kept Corona or formally recognized as COVID-19 still not spread out in our state in a community level. At our state. It's the role of our state citizens. We have been righteous as a pandemic since it first hit our country. So at the rural level, every awareness programs are being conducted at the ward level committee regarding this spread of this coronavirus. And at the village level itself, every ward, there we have the sanitizing group formed, and then we are sanitizing each and every household. So spread, we are stopping this spread of coronavirus at the grassroots level itself.
Right.
Hello?
Yes, sir. Yeah, we just heard you. We'll come back to you again, and we will just go back to Mizoram once again. That is in Aizawl once again.
Yeah, I'm here.
Yes. So you were just saying, I was just asking you that how are you managing, how is it being managed, a sustained one? Because this is a sustained one. It is not going away from our lives so easily. And the effort has to be a sustained one. So what kind of help, what kind of governmental level or from the private community level kind of help to make it a sustainable one are you realizing from the community also?
Yeah, one thing I want to point out before I go to the funding situation, as a Mizo, we have something which is called Klomgaina, which is a selfless sacrifice, which is also an altruism, and we are a communitarian society, or sometimes also called collectivistic society.
Okay.
So where everyone help out each other in the community, and this has been a part of our life all the time, I would say.
Right.
So whenever a person is in need of, let's say a food or other problems in terms of death or in terms of, medical emergencies, let's say, people will just help out of even though they don't know those people, but they will just help out because of Klomgaina.
Okay.
So about the sustainability also, when I was talking about the task force both at the local level as well as at the village level, I would like to point out that they started off without any funds from the government. It was actually from the people's contribution,
Right.
what they were doing, they were able to buy all stocks of rice and pulses and other essential commodities when it comes to food, as well as PPEs, like including sanitizers and masks and things like that.
Right, and other essentials.
Other essentials. So I know that it has been a long fight, and we don't know, like as you had pointed out earlier, how long we're going to fight this COVID-19. Whether people are going to be still in that altruism
mindset.
Mindset. But the thing is, because of Tongwe, which is so deeply ingrained in us, I still feel that, donations from other people will still come, even when, I'm not saying that the government is not funding, is starting to fund, but of course it's not enough, which we know very well, because we're not rich, we're not a rich state. But then the people help out each other in the locality, and till today we have not heard of anyone in the locality who is having problems with hunger or lack of essential commodities.
All right,
because of the work of the LTF.
Okay, let's just bring in our panelist from Imphal, Dr. Arambam Noni Singh, who is the Assistant Professor, DM College of Arts, Imphal. A very, very warm welcome to you as well, Dr. Noni Singh. Yes. Wonderful to have you finally. A very warm welcome to this live Radio Bridge program.
Thank you for having me.
Okay, so tell us, how is your state coping up with COVID-19? Tell us a little bit about what is going on in your state, and also the community role that is being played there.
I think while referring to the title of the talk, that is CSO's role in combating COVID-19, at the outset I would just like to refer to what UN says on the importance of CSOs. It says that UNO says that CSOs function like a third sector, the other two being the government and the individuals. Now, it is important to understand one very important facticity, that in the Northeast India, each individual is deeply connected to a social network. Therefore, we have been talking and celebrating what we call Asian values of social coexistence in a very combined manner. Now, having said this, I just want to reassert by saying that the role of the CSOs in combating COVID-19 should have been very, very important, and therefore their role is unquestionable.
Right.
Now, as we have been talking to other panelists, I think I want to mention about Manipur's case, particularly in terms of the role of CSOs, by highlighting three important points. One very important point is that a joint committee for public awareness on COVID-19 was formed on 26 May 2020 under the leadership of the present Chief Minister of the state. Now, it is important for all of us to know that there are 9 important CSOs from all across the state. Now, they've been working on particularly awareness. As you said in the previous point, that there is a lot of stigma around.
Absolutely,
people are not very aware of these COVID-19. So this particular committee actually worked on creating awareness and transparency, particularly. Transparency, I would refer to the governmental activities and their policy implementation. And I think I must say that this joint committee for public awareness on COVID-19 has played some great role in terms of ensuring community harmony in the state of Manipur. The other two, the second important activity comes from another organization called People's Task Force on COVID-19. And this has been working on implementation of governmental policies properly and transparency and ensuring who are suffering and who are not suffering and trying to resolve their problems and so on and so forth. And one more very significant third case that I want to assert here is that there is an organization, a collective called Thankful Coordination Committee Forum on COVID-19. And this is particularly functioning in a district called Ukhrul. And their main works have been very, very celebrated in the state of Manipur because it has become a role model, because they have constituted a kind of village committee and they've been constructing quarantine centers and trying to do a lot of monitoring work. And because of their great intervention, I think one must give a credit to them, because in the state of Manipur, people normally consider that COVID-19 is in the initial stage of community transmission at least. However, the government would like to take a position by saying that COVID-19 has only reached the level of local transmission, not community transmission per se. Now, I think the role of CSOs in combating COVID-19 should be very important.
Right.
However, we should also not fail to underscore the gap, the gap areas where the government and the CSOs have not really come together properly. So I also have a feeling that, there is a lot to do in terms of producing better synergy, and, you can't simply rope in these CSO activists in fighting COVID unless there is a proper awareness and training. If you look at the situation in the entire India, we already know the fact that a lot of health workers have already been infected by COVID-19. If the doctors and the nurses could be infected, I think for the CSOs, they have to be very, very cautious while dealing with this very contagious virus. I have a feeling that when we celebrate the role of the CSOs in fighting COVID-19, one has to also acknowledge the gap areas where the government and the CSOs have completely failed to come together. For example, on matters like maintaining SOPs and fulfilling shortages of health workers and ensuring quality food, quality PPE, quality masks, and all kinds of problems are all still lingering on.
Right, yeah. I'm so glad that you brought in so many important points. First thing that you have really stressed on was creating awareness, because that is so significant. I think all the states in the entire country, that is the first thing that they did also, because there was lack of awareness, and therefore in the beginning there was a lot of stigma also. Our frontliners were being attacked and targeted, etc. We have seen that also. And then what you have said, the building of trust, that synergy that needs to be built, that is also very crucial. So according to you, what more needs to be done? Because you have already laid the points very clearly, what are the works being done in the state, etc., by so many groups and voluntary organizations. But there is some gap, you still said. So in what way can that gap be reduced? What kind of synergy mechanism, therefore, is required?
I think two issues are very important. First issue is that we all know that there is no medicine, there is no vaccine to cure the COVID-19 virus.
As of now, yeah.
Yes. Now, second aspect of the problem is that since there are no medicines to treat the problem, I think the best way to combat COVID-19 is to rope in a good social networking while ensuring collective action on COVID-19 fight. For example, if you look at Manipur or many other states, despite all types of great SOPs, people have not been able to follow the SOPs properly. Question is, why is it happening? Perhaps because the question of awareness, perhaps because there has been too long implementation of lockdown, and the poor people are extremely worried and suffering at the ground. So therefore, I think a lockdown cannot be a permanent solution, as we all know. And therefore, I think what the government needs to do is to look at the issue of the people who are suffering at the bottom level and who has exhausted their food grains at home, who have lost their livelihood questions. Now, I think we need to also learn to live together along with, this very difficult disease.
Absolutely. I mean, this is a point that I was just coming to, and I will just bring in you a little while later, because I want to address the next question also to Dr. Lalrem Ruati, who is there with us in Aizawl, because there is an increasing stress now on, behavior modification. We need a behavioral change, because COVID is here to stay till we get a proper vaccine, which all of us can afford. Till such time, COVID is here, and therefore we need this behavioral change to come in. What do you have to say about this? Because this is an increasing stress that is being made by the government and the agencies also, that we need to bring the change within ourselves now. We have been living a lifestyle very different, and now our lifestyle needs a change, because we have to live with this COVID situation, it seems.
Yeah. We keep on talking about the new normal because we know that since the COVID is here, we don't know when it's going to go away. We don't know when we are going to have the vaccines. We don't know when we're going to get the medications. So we have to actually learn to live with the virus. So I think this is the sad truth that we all have to come accustomed to.
Right.
For example, wearing a mask has become very, very normal. And not wearing a mask is actually a crime.
Yeah. And when we see somebody not wearing a mask, we actually go ahead. At least I have gone ahead to that person and told him or her.
Right.
Or if they don't maintain social distance.
There's a fine of ₹100. Yeah. If you don't wear a mask in public,
In our
You
state,
get
it is
fined.
rupees 500, ma'am. Yeah.
Yeah, that's great. We should up. We should up the price.
Yeah. Yes.
Yeah. So hand sanitizers, the word sanitizer itself has become, our language.
Right. And social distance, I think this is also very important.
Social distancing. I think we really have to come to terms with what is considered as a new normal is really our normal.
Which is difficult to accept, but then we have to accept, right?
Of course. And then I would say this again, that in Mizoram, the local level task force as well as the village level task force, they have been very, very strict when it comes to ensuring that lockdown is actually working.
Yes.
Policing the area, including the border area, and whether a person is wearing a mask or not. Things like that are happening here. So we are, in terms of being aware about COVID-19 and its how dangerous it is, I think we've been quite aware.
You are doing quite aware and doing well also. Okay, hold on to your thoughts. Let me just bring in our panelist from, Itanagar once again, Dr. Jegi Ore. Yes. Okay, we almost thought we lost you. It's good to have you back once again, sir. Because, in Arunachal Pradesh, what I've heard is that, because I have friends there, I have colleagues there who work in Shillong from there, and I've just been speaking to them, and one of my colleagues said that many landlords there have voluntarily exempted the rent in many places, and in some villages, the villagers themselves have built rooms where the returnees could be home quarantined. There are examples also, like in Mirem village in East Siang district, that such thing has happened. Can you just fill in us in a little bit more?
Yes, that is true. Especially in Arunachal Pradesh, in the capital region, Naharlat and Itanagar, here many of the rent owners, they exempted the waive off the rent. Especially the place where I'm staying is also a rent. Here 8-9 doctors are here. Here also for the month of April, the rent owner, they didn't collect the rent for us. All the warriors.
Right.
And then, likewise, many of actually in Itanagar and Naharlat, they have waived off this rent.
Right.
And that is true. And it's a very actually welcome and
very heartening. And I believe, free rations are also specially being distributed to the taxi drivers, since, their business now is affected in this lockdown period. Yeah. And the youth, they are being very, very active, and they are very, very kind-hearted. In fact, voluntarily, they are distributing a lot of financial assistance to the needy as well.
Yes, and then regarding Miram village, it is already acknowledged by Honorable Prime Minister of India. They have already constructed a local house for returnee actually for the quarantine. And from the community level here during our lockdown also, when our students, they were returning, that time also many of the community organizations, they collected money and they have transferred the amount to the respective cities, those who are already stranded there. That is one of the good efforts actually the CBO's community organization has taken up.
Right.
And another issue they have taken up is the awareness. The awareness, because initially there was a matter of stigma.
Right.
And the stigma also, up to some extent, from the community level, they have reduced. Because our Chief Minister has called them, all the CBO's leaders and other stakeholders in the different community, and all the awareness was imparted in different through the different media. I just wanted to touch on one of the very vital issues is the disposal of a dead body.
Okay.
And the disposal of dead body also, it's really, we need community participation because in many, especially even we have heard in the news that in Meghalaya also there was some problem.
Initially, yes.
And likewise, even in our state also there were 3 deaths, but because of this community mobilization and all, we didn't face that much a problem. So that's why this is very, very important. And other issues is the suicide issue.
Okay.
Like in Arunachal Pradesh, the incident of suicide also we have faced around 8-9 cases here. It is directly or indirectly related to this COVID pandemic.
Absolutely.
And here also community level, because we have to structure our supporting system in the macro level. We have to enhance our community supporting systems, because what happens is when there is a lockdown and when there is a difficulty in accessing the essential community or the essential services,
right,
and then they get depressed actually, and those those who are vulnerable groups, like very poor people, and then those who are already suffering, and those who have already had a mental comorbid. So they easily succumb to this suicide or other depression.
Right,
So I just wanted to make to the public that wherever you live, actually, even in a small cluster or even a small rent or anywhere, you should develop supporting structures within your macro level, in the community level, even in the small level. If anything happens, say for example, one is positive, then it is the duty of the neighbor to help them. There are many times like the positive has been transferred to the quarantine center, and there is a small kid who is negative in the same building or the same locality, and there are nobody
to take care.
After them. Those times, and you have to. It is the duty of the neighbor to help them. And
absolutely, and this is what is called community participation, community effort. The people's movement. Just hold your thoughts, sir, because I just want to bring in Dr. Lalrem Roati, she is the assistant professor, Department of Psychology. Ma'am, tell us, because this is so important, because now we are all talking about the mental health. This COVID and mental health has really become an issue now. People are talking about it. There are webinars happening. There people are really talking about this issue, which was not being spoken. But now, this situation is so abnormal, and we are so, under house arrest. Not everybody is mentally strong to be able to take it, and especially if their livelihoods are affected. So,
right.
How do we deal with this situation, ma'am? Yes, the mental health. Yeah.
What the pandemic brings in is mental health issues. So, as we know, as we have heard that, I'm very sad to hear that Arunachal Pradesh has suicide cases, that many suicide cases during the lockdown. In Mizoram, I have to talk about Mizoram. As I have said earlier, as a clinical psychologist and as a part of the counseling cell, we have visited all the government-funded quarantine centers in Aizawl district. We were hoping, I would say, not actually hoping, maybe a very harsh word out, but then the thing was, we actually thought that we would see depression cases, anxiety cases, things like that. But the thing is, we did not see that many cases of mental health issues.
Okay, that is wonderful.
Which was quite a challenging,
What is one of the possible reason you feel that
the reason
people are
I would say is because of the good social support system, as well as the belief that we have in God, the hope that we have. So that really actually worked for our mental health.
Absolutely, and that
positively.
That is really, really good to know. Yes, I think we can go to Gangtok once again, because as I said, with the other 3 stations, we are telephonically being connected with them. All right. So, Mr. Norbo Lamtha.
Yes.
So tell me, what are the challenges that you all have faced, and what more needs to be done when it comes to the question of community's role? What kind of synergy? Because, our panelist, Noni Singh, has brought out this very significant point that there should be more synergy that should be built, the trust factor that is missing should be brought. And what kind of a synergy mechanism you feel is required?
Yes, ma'am. Initially, line was not clear.
Now you're perfectly clear, sir.
I'd like to give you a brief overview of my state.
Okay.
Sikkim is a border state sharing its border with 3 international neighbors. That's Nepal, Bhutan, and China.
Right.
And our population is 7 lakhs. And it's spread out in a total area of 7,096 square kilometers. Community-wise, we have 4 communities, Nepali, and business community. So right now, it is currently at the second lowest figure among all the states in the country.
Right.
This mainly, Sikkim is a close bond community. And people here are compassionate and law-abiding citizens. The entire civilian population of Sikkim cooperated with the lockdown guidelines and safety measures of state government and central government. Not just that, but we the citizens also assumed minor roles in helping our state battle COVID-19. Our government is doing at their best because initially we don't have any cases, and we were the COVID-free till May 23rd. As the saying goes, the necessity is the mother of many inventions.
Right.
And it is that we have implied in our role in tackling coronavirus. I being a retired civil engineer and founder of the Sikkim Himalayan Football Club, I could not fight the pandemic as doctor in the panels and nurses do. However,
along with the community, you could do it more, right?
Where there is will, there is a way.
Absolutely. Absolutely. And we really, really wish your state well. Sir, we really wish your state well. Yeah. Yeah,
Yes.
because we are almost running out of time. We are running out of time, sir.
The means of sanitizing typical areas around our state with arsenal of NCDC approved chemicals in fighting COVID-19.
Right, right.
And there are many other groups joined.
Also who are, yeah. Like I think in most of the states this is happening. Many groups, many individuals are voluntarily coming up and doing so much. As we are almost wrapping up this program.
Yeah.
Yeah. We are almost, your last quick thoughts, ma'am, before we bring in Noni Singh once again.
Yeah. I'd like to say that thank you so much for having me again.
Okay.
And about the community participation, it's lovely to know that, from the other states in Northeast, we are seeing such a positive, heroic face in all of the community.
Absolutely.
So that was such a nice thing to hear, and it gives us hope that we will eventually win this fight against the COVID-19.
I think this is the resilience, the human resilience is so strong that we will together fight it. Okay, I just have to bring in Dr. Arambam Noni Singh. I just give you 1 minute to conclude. What are your concluding comments that you would like to make as we wind up this discussion today?
Just very briefly, without a critical role of CSOs, I think community transmission in the Northeast would have easily begun. Number 1 point.
Right.
The next point I want to raise is that the governments in the Northeast India need to listen to CSOs in order to ensure fair distribution of welfare schemes, and to also have an exit plan from the lockdown.
Okay.
I think it is very important that the governments understand the role of the CSOs, because without an initiative of the CSOs, it looks like we shall not be able to go on in a longer term fight against COVID.
Absolutely. And we really hope that in the days ahead, that this kind of understanding will be brought about, will grow more. Thank you so much. Thank you so much. Each of our panelists, Dr. Jago Ori from Arunachal Pradesh, Dr. Lal Rem Ruati from Aizawl, Shri Tenzing Norbo Lamtha from Sikkim, and of course, last but not the least, Dr. Arambam Noni Singh from Imphal. Thank you all so much for, making this discussion so well. We really wish you all the very best to each of your state, and together we will definitely fight off COVID-19. Thank you. All right.
Thank you.
So, dear listeners, I'm sure that you've enjoyed listening to this panel discussion today. The topic was community participation and efforts in combating COVID in the northeastern region. Thank you so much for tuning in to this program. Well, this program wouldn't have been enough without our engineers on duty, and they were Sandy Basayamoit and Sushil Chaudhary. This program was produced by Jay Gangte and Evelyn Kongsip and assisted by Mamsi Dorabla. And this is your anchor and moderator, Dr. Moshmi De Chakravarti. From all of us here from the Northeastern Service, is wishing you all good night, stay safe, stay healthy. Bye-bye. Good night.